which kind of talks about two issues I want to talk to today. The disconnect I kind of saw between UHB and the community, and the lived realities of people that they served, and how certain branding and language used at this NGO kind of framed the community they sought to serve as like lacking knowledge. But I will say, when this program started, I was really excited to be in the field, right? Me and Heather like really excited to be in the field, especially with our colleagues side, how they were in the field like every day. So we kind of, when we got there and they were like, oh, you're gonna be in office for a majority of the time, we kind of felt like, dang, like, you're not gonna be in the field. Like, that's kind of like what we came. But one of our professors, Dr. Lugo, really told us that the field, she really questioned like, what is the field in anthropology? Like, the field is what you make it. And I felt like if we were to be more closed-minded about not being in the field, we would have lost sight of actually the things that we did pick up, the things that we did learn, to where the field could be anything that you, not necessarily that you want it to be, but in the circumstances where anything that can happen, you're gonna have to pivot and adjust to make do of the situation that you're in. To like really expand our understanding of like anthropology, of like what it means to like be in the field and like take field notes and things like that, like observations, participation observations, and where you can conduct interviews. It's not always going to be like in a room by yourself. You might have to do an interview with like 50 people in a meeting, you know? So that was like a really interesting thing. So I want to bring up, which this topic kind of made me think of Fanon and his analysis of the native doctor and his book, In a Dying Colonialism. We're really in this section of medicine and colonialism. He kind of reveals how medical practices were used as tools to control and subjugate, and used as tools for control and subjugation by a colonial regime, how Western medicine was introduced to civilize the native population, often dismissing and undermining traditional health practices, to where nurses, and I bring this up because nurses felt a disconnect with the patients that they were serving. They kind of